And now to a special WSLS Health Team report on the concerns with one type of a common joint procedure. Since 2010, 3 international health agencies have issued alerts or safety advisories for metal-on-metal hip implants. Former WSLS anchor Frances Scott shares that concern after experiencing pain when she got a double hip replacement using metal-on-metal implants. Tonight, Frances shares her story with us, and I talk with a local surgeon about why he and his partners stopped using the devices in patients. For Frances Scott, even the most mundane of chores are painful. Washing dishes requires a stool, folding laundry sitting on the floor.
After I started having pain, I started looking into why I could possibly have more pain. I never really got better after I had the surgery, but I never really got pain relief.
Never got relief from double hip replacement surgery she needed because of the way her bones formed after she was born.
The femurs had to kind of grow twisted, like a tree would grow through a fence to get to the light. My femurs had to kind of grow and twist to adapt to allow me to walk.
She was sold on the idea of metal-on-metal being the most durable option available.
It could possibly be the only one you ever get. It could possibly last you your whole life.
But that may not end up the case.
Frances didn't have her hip replacement here at Duke, but she has had some follow-up appointments here because of her pain, and she says she's glad someone's listening to her and trying to help her.
I appreciate the doctors that say, I believe that you hurt, and I don't know what's wrong, and I'll keep looking.
We wanted to learn more, so we asked Dr. Michael Wolf, a Carilion Clinic orthopedic surgeon, to help us understand.
A hip replacement can take anywhere from an hour and a half to 2 hours, and Dr. Wolf says he does about 100 of these procedures a year.
But none of them are metal-on-metal because he and his partners think too many questions surround the devices. He's had to replace them in patients who've been referred to him.
So this metal-on-metal hip was associated with pain and elevated metal ion levels, and so we changed it to a metal-on-plastic.
Tests show Frances has elevated metal ions in her blood.
I started doing research and I started realizing these things are releasing dust and metal ions in people, and some people are having a lot of pain and a lot of tissue damage.
We do know that certain people, as I say, about 1 or 2% develop this very brisk inflammatory response to the metal implants, which we're really still trying to fully understand.
Would you feed it an orange for me?
Fully understanding is hard for Frances, who tries to keep life with her kids as normal as possible, even as new details are being discovered.
Newest information is showing that the metal ion release is probably coming from corrosion where this ball attaches to the stem here. It's called the trunnion. And so this is new information that's just come out in the past year, and I think there will be even more information that comes out as we go along.
Before Frances goes through another replacement, she wants to be certain that's the best option for relief.
We're checking my back now to see if that could be a factor. I do have a herniated disc, and that could be a cause.
Or could she be one of that small percentage destined for metal-on-metal side effects? Even without knowing the specific cause, the pain has in a way become a source of strength.
You fight to get back any semblance of a healthy life that you ever hope to have.
I do want to point out not everyone has pain from metal-on-metal joint replacements. And we did check in with Frances today. She and her family were living in Raleigh, North Carolina. They're now moving to Texas, where she'll continue checking in with doctors there. It's really difficult to predict how the body will react to those metal joint replacements because there are no metal tests. You know, the skin metal tests don't work for that. The reason metal on metal reacts and metal on ceramic does not react is because the ball on the end of those metal on metal joints is larger than the one that they use in the ceramic socket. So a lot of questions.
And still, you know, we talk about hip replacements now like it's an everyday thing, but there's still just a lot they don't know.
And the recovery, you know, about 4 months later, you should be feeling pretty good. And 4 months after her surgery, she was still having significant pain.
Yeah,
So
I've got a lot of friends who play golf, and they're back on the golf course and no pain after hip replacement.
we will be following up. I'll be following up with a patient in December who has a similar metal-on-metal replacement, but has not had any issues. So we'll take a look further.
All right, well, we wish Frances all the best.
We do. It was good to see her.
Right.